In the meantime, to improve health outcomes for Nigerians, there is an urgent need to address the healthcare system and the broader socio-economic challenges. CEO of Nigeria Solidarity Support Fund, NSSF, Dr. Fejiro Chiyonwoko, said this at an event to recognize outstanding Nigerians for their philanthropic gestures towards strengthening the nation's healthcare system. Justin Akaroy tells us more.
The COVID-19 pandemic worsened the nation's health system, resulting from redirection of funds, fewer healthcare workers, and poor hospital utilization. The NSF explains that weak healthcare system is underpinned by unclear governance, poor financing, inadequate human resource, and poor information systems. However, with a target to support the vaccination of 1 million Nigerians across 6 states, the fund, in collaboration with the National Primary Healthcare Development Agency, NPHCDA, surpassed this target by 60%. So what is next for Nigerians beyond vaccination?
What we did was to assist the NPHCDA to actually roll out vaccination in 6 geopolitical zones faster and quicker than they could have done. And it was a fantastic collaboration. And that's what we talk about strengthening. We are not trying to reinvent the wheel. We're not trying to do anything super new. We're just trying to strengthen what we have on ground.
Access to care is a big issue because we know that finances is a major issue for many Nigerians. 4 in 10 Nigerians are living on the poverty line. And so if they cannot access care because of finances, they most likely die from preventable causes. So we are trying, one priority area we are looking at this year is to improve access to healthcare. And we know that access to healthcare is not it. Also the supply of healthcare. We know that healthcare workers are leaving the country in the drones. A lot of we don't have as much healthcare workers as we need.
At this gathering, these Nigerians are celebrated for their passion. They speak of their inspiration, which is born out of the need to transform the lives of vulnerable Nigerians, as well as reskilling the nation's workforce and also strengthening its healthcare systems.
Given the impact of COVID at that time and how it brought so much focus on the inadequacies of our health sector. So naturally, strengthening the health sector became the focus of our conversation.
Protecting vulnerable Nigerians, right? That is key because I think for organizations like this, such people sometimes are neglected, they are not catered for, they are not remembered.
We don't have a social security system, so taking care of the vulnerable people in our society is critical. We must look after our neighbors. In terms of healthcare, I have personally been affected by the lack of good healthcare system in Nigeria, and I'm totally passionate about that.
The World Bank says over 95 million Nigerians are estimated to become poor by the end of 2022. What can be done in terms of improving access to healthcare?
Poverty has so many ramifications. It's not only healthcare that will solve poverty. Education will solve poverty. Wealth creation will solve poverty. But the truth is that all these various legs need to be addressed.
In all, these advocates want to see a shift from paper-based data collection, incomplete and inadequate records, as well as poor disease surveillance. Justin Akadonye, Plus TV News, Lagos.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.